Coming up on the Doctor's Hospital podcast.
And to me, telemedicine has become a game changer as I can provide healthcare and reach so many more patients I might have been able to, particularly for patients, let's say, in our family islands where there not might be access to a dermatologist.
At Doctor's Hospital, our lamp just got brighter. The Loyalty Advantage membership program now has 3 unique plans to choose from. From Lamp Prepaid with free prime care visits and service line discounts, Lamp Insured with copay waivers and 0 upfront collections at the ER and inpatient services, or our new Lamp Access, a free plan that offers 10% off lab, pharmacy, and imaging. Lamp has a plan for everyone. To sign up, visit our website or give us a call. Doctor's Hospital, trusted and best care now.
Welcome to the Doctor's Hospital podcast. I'm your host, Alexis Burrows, Marketing Director at Doctor's Hospital. We are pleased to be joined today by Dr. Ormanda Johnson, who is a dermatologist now working in the Doctor's Hospital health system. Welcome to the show, Dr. Johnson.
Thank you. It's good to be here.
We are happy to have you on. I'm primed to a very interesting conversation today. This is not necessarily my wheelhouse. So I'm going to be interested to see just kind of your answers to some of this as we go through it, knowing that this isn't necessarily my space. So I'm looking to learn along with our listeners today. So I always like to start with, especially someone who I've not really engaged with in a lot of different forums. I like to start with getting an idea of your background. So can you tell us a little bit about your journey into specializing both in dermatology and family medicine? Because obviously you operate in both spheres. So how did you make that decision to end up doing both?
Right, absolutely. So after medical school and internship, I did both of my postgraduate specialty training in England. I did the dermatology with St. John's Institute of Dermatology. That's based in St. Thomas and Guy's Hospital in England. And then my family medicine training, specialty training, or residency, I should say, with the Royal College. After that, I practiced and lectured in both dermatology and family medicine in England for many years, for about 10 years, and then relocated my practice to the US, to Maine, where I was the medical director of a large health center and practiced and dermatology and family medicine there as well. Lectured with a lot of universities and still remain on faculty with the Ivy League Brown University.
Nice. Very nice. So it's quite a journey there, both through the UK and then through the US. What would you say is your most interesting, or I guess what drove you into the space of dermatology? Because I know we don't necessarily have a lot of them here. I think you're one of a very, very small number. So what kind of led you in the direction of doing dermatology in the first place?
So, what drove me into dermatology? I had a family member with a lot of serious skin complaints.
Mm-hmm.
And that was one of the main reasons why I wanted to do dermatology. And it fits in so nicely with family medicine because I find that probably 1 in 5 individuals who walk through that door for family medicine are actually coming for a skin complaint.
So you find that there's a very close interaction between the two, and it only made sense then.
Oh, absolutely.
Okay. Awesome. So let's move into, some of the things that people think about, look at, and maybe misunderstand as it pertains to dermatology. So what are some common misconceptions you would say that people have about skin health?
So I would say the first one in our population is that persons of color either do not need sunscreen, or if they do, they just need a little bit of it. And that's not true. Everyone needs to use sunscreen and they need to use it daily. You need to use at least a SPF, or that's a sun protection factor, of
Hmm.
at least 30. You need to apply it on all areas of the body, the skin that's exposed to the sun. Yeah.
Wow, I wouldn't have anticipated the everyday. I guess is it because just of our closeness to the equator and just how hot the sun is here, or is that no matter where you are?
So that's another misconception because people think that you don't need it every day, but you do. Because
Hmm.
not only in places that are sunny, but you also have, if there's, say, cloud coverage or rain, you're still getting harmful UV rays that can still penetrate. So everyone year round needs sun protection.
Awesome. Okay. So now I know, one of the little interesting nuggets. I have a kid in primary school, and they're so far ahead with their teaching them. So one of the things they talk about is, the skin is the largest organ in the body, which she will happily tell you. But because of that, I imagine, there's a lot of impact that skin health has on people's overall well-being, their physical health, their emotional health, their mental health. So what would you say, like what level of impact would you say that skin health has on those areas of your overall health?
So you touched it exactly. The skin is the largest organ of the body. And naturally, it's the one that everyone sees when they first encounter you.
Hmm.
Not too many people are going to say, "Oh, that's beautiful lungs you have," or a lovely set of a gallbladder that you have. But the
Right.
skin is what you see. And the common skin conditions that I treat, let's think about like acne or eczema or psoriasis. A lot of times they're on your face. And if they're on your face, that can lead also into poor self esteem,
Hmm.
low confidence. It also can lead into mood disorders, things like depression or anxiety, and all the things that come from that. It can markedly, you know, it can markedly negatively impact your quality of life. And one of the questions that I ask people when I see them is, how is this skin disorder affecting you,
Hmm.
affecting your life? Not to mention, physically, some of the skin disorders are very uncomfortable. If you think of eczema, you can get an intense itch, an
Hmm.
itch that even can, keep you up at night, and in fact, impede your sleep. And the reverse of that is when you have, good skin or clear skin, I should say. I love to see you when patients come back in. They're walking through that door, their head is high, they're
Hmm.
full of confidence, they're smiling, and they're ready to face the world.
Yeah.
So, it markedly has an impact on you.
Yeah, it's like the before and after photo. Where in the before photo, they're sunken down, it's poorly lit,
Absolutely,
and then the after,
absolutely.
you have this brightly lit room, big beautiful
Beaming,
smile,
beautiful
right?
smile.
And I guess it goes to the idea that people always say, look good, feel good, that sort of thing. So
Mhm.
obviously that tying in with, it's the thing, like you said. I guess I didn't think about it like that. It's the thing that the organ that people will see. They don't see your lungs, they don't see your heart, they don't see anything else. They see your skin, and it's
Absolutely.
front facing every day. You touched on it a little bit, but what are some other prevalent skin conditions that you encounter in your practice, and how do you typically approach diagnosis and treatment?
So there are a lot of common skin conditions I see, and common being common, I think number one is acne, and followed very closely by eczema, psoriasis,
Hmm.
vitiligo. You have warts, you have skin tags, seborrheic keratosis, other benign skin conditions, as well as your skin cancer.
Right.
And then a lot of people don't realize that dermatology also encompasses not just your skin, but your hair and your nails.
Hmm.
So with regards to hair, you have just general hair loss. And then with your nails, I would say fungal infections.
Okay. So those would be a lot of the main ones.
And with regards to diagnosis, it always starts with a good history and obviously and physical exam. And if needed, then you might need further investigations,
Right.
perhaps a biopsy, etc.
Okay. Understood. You mentioned a couple of these here, and I'm going to jump ahead to a question to kind of just jump off of that point. But you mentioned vitiligo and psoriasis and things like that. I know some of those have connections to autoimmune disease. So, what role does autoimmunity play in dermatological conditions?
So when we say autoimmune diseases or
Hmm.
conditions, these are conditions when your body's natural defenses, I like to say the police of your body, are attacking areas that it shouldn't really
Right.
attack, okay? And we talk about hair loss. So hair loss can be caused by a lot of things, but sometimes you hear people say, "Oh, I've got alopecia causing my hair loss."
Hmm.
So the autoimmune condition that they're referring to is alopecia areata,
Mm.
and that's what results in hair loss. And in that time, the body's natural defenses are attacking the hair follicles, causing them to fall out. But then this can be linked with other disorders, your type 1 diabetes,
Hmm.
thyroid conditions, things like that as well.
Lupus, I
A-
imagine, as well.
And vitiligo, yep,
Right.
absolutely.
Okay. All right. Because I mean, I think sometimes, it's good to go beyond just the I guess beyond skin deep, as a lack of a better way of putting it, and look at what's happening behind the scenes that may be leading to it, because you're talking sometimes a lot about symptoms, but it's good to know that you're looking at that background as to what may be, at the root of what's presenting in the skin, in the hair, in the nails.
Right, because you
um
find people come in and they might necessarily realize what else is going on, but they
Right.
recognize I'm losing my hair.
Right.
They're recognizing, oh, I'm getting these white spots, the vitiligo on
Hmm.
my skin. So these are things, but they don't realize that it can be internally linked
Right.
with other
It might be
conditions.
tied back to something that's
Absolutely.
rooted more deeply in their health, overall health. Okay. You also mentioned skin cancer. And I imagine, especially in, again, this may be a misconception, but especially in an environment like ours where we are exposed to a dreadful level of heat most of the year, skin cancer awareness is then crucial. So could you share some insights on prevention, early detection as it pertains to skin cancer?
Okay, so we briefly talked about it, and I would say, with regard to prevention, wearing sunscreen daily.
Hmm.
So, wearing sunscreen daily is one of the single most important things you can do to
Wow.
protect yourself from the sun. When you wear it or apply it correctly, it protects your sun against the sun's those harmful UV rays, which causes sunburns and some skin cancers. For the best protection, you need a broad spectrum, water resistant sunscreen with an SPF, that's sun protective factor of 30 or
Hmm.
higher. And you need to apply it, like we said before, all over, all areas that are not covered by
Hmm.
clothing, and reapply every 2 hours or if you sweat or swim.
Okay.
And not only sunscreen, also use your protective hats, protective clothing.
Okay, that makes sense. Does that 2 hours change? Like, so for example, I work a desk job, right, where I'm inside most of the day. So does that every 2 hour reapplication apply to me, or is that something where, like, if I put it on the way out to work and I come into work and I'm here for 4 or 5, 6 hours before I go out to lunch, something like that, then I reapply at that point? How does that work?
Yes. So if you're indoors most of the time, you don't have to keep reapplying it
Right.
every 2 hours. But
Yeah.
now, if you're stepping out, you're going to lunch,
Right.
and it's been several hours since you've applied it, then you need to
Yeah. I don't want
reapply
my
it.
team looking at me like I'm a ghost every 2 hours, reapplying sunscreen for no
Absolutely.
reason.
They will be looking at you. And then it's important too, I think, to talk about how do we detect skin cancer.
Hmm.
So I always tell people it's important to check your skin regularly. You need to do that on average of once a month. Okay. You're looking for any new spots. And another thing to note, you should not get new moles and new spots after the age of 30. So be very careful if you're seeing moles that are coming after the age of 30. I see you're looking
What
around, you're
about skin
checking your skin.
tags? What about skin
Now, skin
tags?
tags are benign, so that's fine. But once they're not molds, all
Hmm.
right, and you're looking for molds that are changing in any way, if they're itching, if they're bleeding, because there are many different types of skin cancer.
Hmm.
Like I said, everyone gets it once you have skin. You have your basal cell, your squamous, but of course, the most deadliest one, the one that no one wants to miss, is melanoma.
Hmm.
And, you just have to think of the late great Bob Marley, who was
Hmm.
used, now everyone's talking about with his new movie. And unfortunately, that's how he passed. He had melanoma, and which easily spreads and
Right.
metastasizes.
Yeah,
Okay.
that's obviously it's on your skin, which again is the largest organ in the
Absolutely.
body.
And in persons of color, the type we get is called acral melanoma. And it's harder sometimes to pick up because it happens
Mm.
on our palms or our soles or under our nails. So persons might think, oh, I might have injured myself. That's just an injury. Or maybe it's a fungal infection. So I always tell persons, not just your skin, you check skin everywhere, check your nails, check your fingernails. If you
Hmm.
see little black spots or darker spots, or these horizontal lines, you need to come in immediately.
Yeah, I think that's something that we probably need to do just some separate information on in terms of how to check your skin, how to check your nails,
Absolutely.
that sort of thing. That's really really critical, I imagine. Um, okay, so I guess going back to the concept of treatment, diagnosis, and where technology is going in the world, telemedicine is obviously something that's becoming more and more widespread. It's obviously something that we've been trying to get into in the doctor's hospital space as well, offering telemedicine visits in a number of different areas. So, with the rise of telemedicine, how would you say that it's impacted the way you diagnose and treat skin conditions?
So, telemedicine is the use of technology to provide healthcare remotely, such as through the phone, the computer, internet, video. And to me, telemedicine has become a game changer, as I can provide healthcare and reach so many more patients I might have been able to, particularly for patients, let's say, in our family islands where there not might be access to a dermatologist. and they now have to incur additional costs to travel into Nassau, or persons who might not be able to get time off from work. So, how I use telemedicine, I prefer to use video conferencing so I can actually see the rash they're talking about, see the lesion, because dermatology is all about that. We need to actually physically see. So,
Hmm.
telemedicine plays a huge part in it.
Okay. So you don't it's not a hindrance or an issue, because I know, so I think people sometimes have, going back to the misconception conversation, right? People sometimes have a misconception that, oh, if I'm doing telemedicine, I'm not getting the same level of care or the same level of detail in care.
In some cases, it can definitely work on equivalent, I would say.
Okay, awesome. It's good to know. So let's take a break right here. We have some important information from our sponsors that we'd like to get to. So we'll do that, and we'll jump right back into our conversation.
Doctors Hospital is proud to announce the launch of our infusion center. This center is available for patients in need of IV hydration and nutrition therapy, blood products, long-term antibiotics, and specialized medicines for a spectrum of diseases across multiple specialties, including rheumatology, dermatology, gastroenterology, and endocrinology. We provide quality, highly specialized care with Doctors Hospital physicians and trained infusion nurses you can trust. We're located at the Luton Building on Daswell Street. For more information, contact us at 242-302-3323 or email us at infusioncenter@doctorshosp.com. Doctors Hospital, trusted and best care now. Isn't your health worth it?
So let's pick back up. Lifestyle has been a conversation. We've been doing the podcast for about going on 5 years now, right? And I find that lifestyle continues to be a conversation, or a segment of conversation that keeps popping up with a lot of the different physicians that I've spoken to. So how does lifestyle, including diet, stress management, exercise, all of those sorts of things, how does that affect skin health in particular?
So, lifestyle factors affect skin health greatly.
Okay.
And if you break it down, let's look at smoking and drinking alcohol. That can negatively impact your skin health. There are many chemicals in tobacco smoke, and several of them can destroy elastin and collagen, which provides your skin with its elasticity and strength. Therefore, smoking can lead to your skin sagging, lead to deeper wrinkles forming. Alcohol dehydrates your skin. In terms of diet, evidence indicates that a diet supporting overall health is also naturally going to be very good for your skin. And that includes eating healthy, getting in your fruits, your vegetables, is something I have to remind myself of as well, and drinking adequate amounts of water. In regards to stress, what doesn't stress affect? Not only your mental, but your physical health and well being. And again, like we already said, the skin being the largest organ of the body reflects a lot of times what's happening internally. And stress can cause overall increased inflammation. It can negatively impact certain skin conditions and trigger them, like the acne, like eczema, psoriasis, and it actually makes them flare. It can also have a
Mm.
large impact on how our skin ages. As those stress hormones, you're looking at the cortisol, epinephrine, break down that elastin and collagen in our skin, and you get more fine lines, you get more wrinkles. And in regards to hair, stress can also affect our hair and its growth by contributing to hair thinning and hair loss. Therefore, we really need to decrease our stress levels.
Yeah, like I said, it's a
That's
constant marker of conversation that's come up over the last few years as we've been doing this. Um, so getting back to the concept of technology, we were talking about telemedicine a while back. So moving more so into the advancements in treatment, that sort of space. Are there any emerging treatments or diagnostic tools in dermatology that excite you, that you're interested in, that you see that may be game changers in the way you approach care?
So nowadays, we have many newer treatments than we have ever had before, and research in this field is ongoing. One of these newer treatments is something called JAK inhibitors, and these JAK inhibitors interferes with signals in the body that are thought to cause inflammation. And this in turn reduces inflammation and then fuels diseases like eczema or alopecia and vitiligo. Another emergent and I say game changing technology or treatments for skin are biologics.
Mm.
And they can target or quiet only the part of the immune system that is overactive. And some skin conditions that can be treated with biologics are your eczema and psoriasis. But I really want to point this out though. So these are treatments that we use for more the moderate or severe cases. These are treatments where, you might have done other treatments that have not worked. So these aren't treatments that you're going to use first line. And of course, you have to be screened for them to see if you're eligible. And some of them might need additional investigations before you start, such as blood monitoring, and to continue the blood monitoring while you're on the treatments.
And can you just clarify with the biologics? That's an infusion-based service, right?
So biologics, you can either do self-injections, so you do them as IN intramuscularly, or some of them you can do as IV infusions.
Right.
And then, but with JAK inhibitors, some of them, well, they are orally. You take it by mouth.
Oh, okay.
Or sometimes even topical, where you put it on the skin.
Oh, so there's a lot of different variations as to how
There
you can.
are
Okay.
variations.
Cool. That's interesting. So, we've talked about a little bit about prevention, and I want to maybe dive a little bit deeper into that. What are some tips that you would have for our listeners for, maintaining a healthy skincare routine?
So the things we've already talked about: use your sunscreen daily, not smoking and drinking, healthy diet, drinking your water. But also, when you think of general skin tips, you need to use skincare products that match your skin's needs.
Mm.
You need to know your skin type. Do you have oily skin? Is your skin dry? Is it combination? Is it normal? Is it sensitive? Do you have other skin conditions going on that might affect it? And you need to use products that are formulated for your actual skin type. And that'll help your skin look and feel its best.
Okay.
Also, another tip I would say is you just need to gently wash your face twice a day. In the morning when you wake up, to take away all the dirt and bacteria that might have accumulated overnight. And also in the evening to take away all those environmental factors or, pollutants that you might encompass. And, just have a simple routine. I always say resist the urge to scrub your skin, as it can really irritate your skin, which can worsen skin conditions, including acne. So generally, you need to just wet your face, first of all, with lukewarm water. You don't want it too hot, not too cold. Then you can apply a mild cleanser. And then in the circular motion, you're going to apply the cleanser, completely rinse it off, and then gently pat down your face with a clean cloth. And then whilst your skin is somewhat damp, apply a moisturizer, because this would help to seal it in.
Okay. I mean, I think your point there about gentle is an important one, because I think generally speaking, especially for people who may not know and they have acne, the idea is to be aggressive, right? So like I remember, it's funny because we were in prepping for this, I was talking with my wife and she was talking about how she had to come to the realization that, her approach to how she dealt with her facial cleansing and stuff like that with her acne was too aggressive because her skin was sensitive. And so she realized the more she moved to more gentle approaches, the more her skin, reacted positively to it, and the more treatable, the more easy it was to maintain taking care of her acne.
And I'm glad you said that, because a lot of people think with acne, you need to vigorously scrub your skin. And that can actually do more harm than good, because you can set yourself up for more inflammation. You can set yourself up for more scarring, which is much harder to treat down the road.
Right. All right. What advice would you have for individuals who may be hesitant to seek medical attention for their skin concerns?
I always say you need to visit myself, a dermatologist overall, if you have any concerns about your skin, your hair, or your nails. In particular, with regard to potential skin cancers, come right away if you have a new or changing skin growth or lesion. I always say, if you are not feeling good about the skin you are in, come on in.
Mm-hmm. Gotcha. And then I guess to add on to that, how critical is the role of the relationship between a dermatologist and, let's say, like the esthetician community? Because obviously, people may not come into you every day or every week, but they may be going to, the person who does their facials or the person who does their nails. How critical is that relationship in terms of being able to have, people maybe on the less clinical side of the fence to be able to say, hey, this is something that you may need to go and talk to your dermatologist about?
I'm glad you said that, because we work hand in hand.
Right.
And that might be more on the cosmetic end of it. And I'm pleased to say we're actually in the process of partnering with a couple estheticians in the local community. And these are persons who can provide additional services such as medical grade facials, peels, potentially microdermabrasion. So these things, what I do is the medical and surgical, and I do some cosmetic dermatology as well because I'm about to start Botox and fillers. But absolutely, we absolutely link with estheticians.
Okay. And I guess it kind of speaks to my next question, which is, how do you approach cosmetic dermatology alongside both the medical and the surgical approach in your practice?
Right. So like you've already said, so there are three arms of dermatology. The medical, the surgical, obviously it involves cutting, and cosmetic. And cosmetic dermatology is just that. You're doing things or treating conditions for cosmetic purposes.
Right.
That's to say the laser hair removal, your Botox, if your fine lines, your fillers, etc. So like I said, I do a lot of that as well, and about to soon implement those services here at Doctor's Hospital.
Okay. And then lastly, what message or advice would you give or would you like to leave with our listeners regarding, skin health, hair health, nail health, and their overall wellness?
So your skin and its overall health and well-being depends on many factors, like we have previously stated. So I leave with saying, be good to your skin, take care of it, and it will in turn be good to you. And if you have any concerns at all regarding your skin, your hair, your nails, to book an appointment with myself, a dermatologist, for a complete assessment.
Okay. And how would someone go about booking you for one of those assessments?
So I work from 2 locations at Doctor's Hospital West and Blake Road, and the number to reach me thereon is 302-4710, as well as Dowswell Medical Center on Dowswell Street. The number to reach me thereon is 302-3321. You can also make appointments online at clinics with an S .doctorshosp.com.
Wow, you did a better job of that than I would. That's good. It's awesome. So thank you again, Dr. Johnson, for joining us on the podcast today. A lot of really good, interesting information. I think there's a lot, especially in the tips and the myth busting, misconception space that are going to be useful for our listeners. And so I want to thank you for taking time out of your busy schedule to sit with us, chat a little bit, and get this information to our listeners.
Well, I thank you for having me.
All right. Awesome. You've been listening to the Doctor's Hospital podcast. As always, we invite you to like, subscribe, comment, and share, and we'll see you here next week.
Doctor's Hospital is reimagined primary care. We have invested to improve our health system, ensuring that accessible, affordable, world-class clinical care is closer to you. Your relationship with a primary care provider shapes the foundation of your overall health. Our new, modern primary care facilities are where critical diagnosis and true personalized treatment begin. With locations across New Providence, Grand Bahama, and Exuma, we invite you to experience the Doctor's Hospital difference. Book your next appointment at clinics.doctorshos.com.